Thomasville Regional Medical Center is an important part of Thomasville, Alabama. The patients in the area we have found cannot get to the larger cities. They may not have means of transportation. They may not be able to take off of work for that long. They can come here within their community within 5 miles of their home and be back to work in the same day, or their caretaker can bring them to here, have the procedure done, and be home before lunch. So we really are trying to bring healthcare close to home.
Let's say you have a real emergency. Patients will have to travel to Mobile. The patient can't make it to Mobile, so it's very important that we have our hospital here. We are in the middle of everything, and you will have to travel at least 100 miles to get the proper care you need.
I had spent a lot of time in Clark County. Clark County is where my wife is from, and she grew up in Thomasville, which is one of 3 major cities in a rural setting for Alabama. And it's a great example for one of the issues that we face in this country about rural health care. It's very important that people aren't penalized because of where they live for their health care needs.
One of our things that we want to stress the most is that we're trying to be the leading rural healthcare facility, and we are trying to provide a future model for, everybody around us. And so we're bringing in services like telehealth, and we have 3D mammography that you can't get within 100 miles. And we have 2 OR rooms, 2 small procedure endoscopic rooms that you don't normally see 2 of those in each. And so we have them all. And so we have negative pressure rooms that helped out a lot in COVID, because we were able to contain that and not be able to spread that throughout the hospital and keep a lot more people safe. A lot of the community that we serve is just your normal families, residents, but then we also have our manufacturing companies, paper, lumber, things like that we also serve. And Westerfeld is a big one for us, and that was based out of Tuscaloosa. And one of the main reasons that they came here is because we are able to provide them healthcare with such a immaculate facility that was able to give them the resources that they need to build a plant like that here in Thomasville.
So it's 2 very important things that this does for any small community. Without health care, they can't recruit. They can't go out to the bigger cities and recruit, even in places like Clark County, where they're so dependent on the timber industry. They're going to need to be able to say, look, we've got world-class health care, and your people that are going to have to move to Thomasville in cities like Thomasville, or if you don't have that world-class health care, they're not going to move the companies there. So obviously that's extremely important. But it's also very, very important for the people that live there, that if they have emergency needs, they have basic health care needs. We've got technology these days that you don't have to drive to the major cities to have your gallbladder removed, or to have your appendix removed, or to have your broken bones tended to. That ought to be able to be taken care of in the places that you live. It's hard to recruit doctors to small communities unless they're from there, or unless you have a world-class facility. Thomasville now has a world-class facility where they can recruit new doctors to.
Being a small community, family is very important. We reach out to everyone here is part of our own family. We all feel like we are a family here at the hospital, but the community is family. Being in a small town, when something happens, everyone steps up the same as a family would. So we feel like the Medical Properties Trust is part of that. We know that several members are in the area, and we do see them, and they get to come by quite often.
So when we started MPT, the model was always going to be that all we were ever going to invest in is hospitals, all different types of hospitals, but that's what we know, that's what we all grew up doing, it's what everybody that works here does. So it's important to us that when we make our charitable contributions and the things that we should just absolutely do to invest back into healthcare. Not only do we invest in rural hospitals, but we invest in many different organizations that provide services in these rural settings. And we do that not just all over Alabama, but we do it all over the country.